Hi, I'm Ellen Lamb, Dr. Lamb, and I'm part of Women's Health Connecticut. I work at Gynecology and Obstetrics. I have 3 office locations in Glastonbury, Rocky Hill, and Hartford, Connecticut. So morning sickness is nausea and vomiting of pregnancy that's very common in the first trimester. Most women, I would say the majority of women, do experience morning sickness in their pregnancy. It is common to start with morning sickness around 6 weeks or so pregnancy, which may even be before your first appointment or first ultrasound with the practice. And it will tend to continue up until around 13 to 16 weeks of pregnancy. There is rarely a chance that people may experience nausea and vomiting of pregnancy throughout their pregnancy into the 3rd trimester. However, most of the time it is limited to the 1st trimester only. Hyperemesis gravidarum is a disorder of pregnancy that's really a severe end of nausea and vomiting of pregnancy. Those people generally are not able to keep much down in terms of food or liquids. They have lost body weight. Usually 5% is the cutoff for diagnosis, but something where people over the course of a few weeks have lost 5 to 10 pounds in pregnancy. Morning sickness in pregnancy is caused by 2 hormones, HCG, which is the pregnancy test positive hormone, and progesterone. HCG is a hormone that will lead to extra nausea and vomiting of pregnancy, especially people who have higher levels of HCG, which would be in twins or a different kind of pregnancy called a molar pregnancy. The other hormone that's commonly leading to nausea and vomiting of pregnancy is progesterone, which is something that slows down gut transit in pregnancy. So you'll find that you'll have more constipation in pregnancy, more nausea and vomiting, and also more reflux because of this slower transit time for food through the GI tract in pregnancy. Safe medications or therapies for nausea and vomiting of pregnancy would be ginger, C-bands, which is a pressure point band acupressure on the wrist that can be purchased, or B6, which is a vitamin that is commonly used in some of the pregnancy medications we prescribe. So it is important to get adequate nutrition and hydration despite your morning sickness. Obviously you need to stay hydrated so you feel well and so that the baby can grow appropriately. So if you are unable to tolerate anything by mouth, you're unable to keep even liquids down, that is a warning sign for the nausea and vomiting of pregnancy. If you are unable to keep down any liquids or solids at all, you need to call your OBGYN immediately, because sometimes you would need to go for therapy like IV fluids or IV medications to stop the nausea and vomiting. But if you are able to keep down most foods and liquids, the best idea is to treat it like a stomach bug, I always say. So eat bland foods, toast, applesauce, any kind of breads or carbs, and making sure you have ginger ale or especially electrolyte-rich drinks like Gatorade or even Pedialyte will help you stay nutritionally stable even if you're experiencing nausea and vomiting. You can request an appointment with me at womenshealthct.com or by calling any of our offices.